Every nurse must know how to check pulse correctly, but sometimes many students fail to know how to count for this pulse correctly. In this video, I'm going to show you the step-by-step process to assess pulse. Welcome to MediShack once again, a place we make nursing and medical concepts simple for everyone to understand. In today's video, we are going to talk about one of the vital signs that most people do ignore and don't know how to access for these vital very well, and it's the pulse. All right, so when we talk about pulse, what comes to your mind? So pulse is the rhythmic expansion of the artery when blood is pumped by the heart. So whenever the heart pumps blood, you can feel it by touching any of your artery, and this is called the pulse. So before you can access for a pulse, you need to know the ranges of this pulse. In a normal circumstance, when it comes to an adults have a pulse of 60 to 100 beats per minute. And when it comes to athletes, they have a very low pulse because of the energy they put in the muscles or the heart pumps in time at all. So athlete has a very low pulse rate. So how do you check for this pulse? Like I said earlier on, it can be felt when the blood pumps or blood is pumped through the artery. So whenever we have any artery which is close to the skin, you can access this pulse. So one of the areas or one of the sites you can access for pulse is the radial artery, the radial, and it's located around the ribs. And then we have the carotid artery, which is located where? It is located around the neck. And we also have the femoral artery, and that femoral artery is also located at the groin. Okay, the groin. Then we have the brachial artery. The brachial artery is located at our arm. All right. So these are the few sites that you can access for pulse. So now we are getting to the most important aspect, that's the procedures and checking for these or accessing pulse. But before then, if you haven't subscribed to the channel, make sure you click the subscribe button and turn on the notification icon so that when we release a new video, you'll be the first to watch. So let's now get into the procedures of checking pulse. All right, so in assessing for patient pulse, you may need some equipment. One of them is your timer or your clock. The second one must be your pen and paper to document. So now the first step in assessing a pulse is first of all, you need to make the patient comfortable and relax to be able to get the right pulse of that patient. Secondly, you need to locate the radial artery. In this case, we are using the radial artery because it's one of the most common sites for assessing pulse. So we are using the radial artery, which I said it is located at the ribs. After you've located the radial artery, you need to now first use your index and your middle finger and press on the artery, not too strong but firmly on it. Then now you start feeling the pulse. So after you see that, okay, I'm feeling the pulse, you now count the pulse for 60 seconds. You count it for 60 seconds. So whilst you are counting, you need to take note of this, the rhythm. the rhythm, the rate, and then the strength of the pause, and then the strength of the pause. So as I mentioned that if you are assessing, you need to take close attention to some of these things. One of them is what? The rate. The rate is what? The number of pause you've gotten. And you need to what? Take note of the rhythm. The rhythm, is it regular or irregular? Understand? And the third one is the volume. The volume is basically what? The strength of the pause. Okay, after you've realized, you've assessed this, or you now come to the documentation aspect, because in nursing, documentation is one of the key things that we need to put into consideration. So how do you document pause? First of all, you've assuming example, you've gotten a pause of 76, so 76 beats per minute. Then the rhythm will come. The rhythm is what? Regular rhythm. So after the regular rhythm, then the normal volume, then you are done with the documentation. So I hope you find this video helpful. You've learned about pause, site for checking pause, equipment using when you are checking pause, the procedures in checking pause, and I'm sure this video have been helpful to you. So I would like you to do me one favor by subscribing or following our social media handles. We are on Facebook, TikTok, and most importantly, we are on YouTube. So make sure you click on that subscription button to be able to get proper and educating nursing content. Thank you. This is Medishack. Peace out.